the winged blepharoplasty. Guys, I am sick of people asking me about this. I literally had someone laying on the table the other day, and I was drawing her incision, and she was like, can you make sure you do mine's in a winged blepharoplasty instead of traditional blepharoplasty? And I wanted to just toss the marker across the room. So like, oh my God, this obviously good surgeon who's marketing this from across the way on the West Coast. But the winged blepharoplasty is a very standard technique. Every upper blepharoplasty that I do on a younger patient is a winged blepharoplasty, because that is kind of the beautification aspect of the procedure. It's how we draw the incision, and it's how we are actually making up for not doing everything that we should be doing. Because a lot of people need a lateral brow lift, a brow reset, just a tiny bit of this with their upper blepharoplasty because they have hooding here. Not everyone wants to get a brow lift. Not everyone needs a full brow lift, brow reset, endoscopic lift, whatever it is at the same time, which is fine. What the winged incision allows us to do instead of the traditional old school bleph where you're following down. Again, honestly, I don't know anyone legit who like still draws their blepharoplasties down like this. Maybe some of the older docs do. A lot of insurance related procedures, upper eyelid procedures, will do that because you have to follow the natural eyelid anatomy and crease. And if you have really droopy brows, if you're getting a Medicare upper eyelid surgery, you're probably not going to have a winged blepharoplasty because your brows are too droopy. There's too much tissue here. You can't wing across this and cut out a chunk of your brow and wing that. You got to follow where the real eyelid skin is that you're going to remove. Younger patients who aren't like this, it's not you can wing this. You could wing my bleph. We wing it up, looks all pretty, but nothing. But if you're older and your brow's like this, you can't wing that incision because you're removing eyebrow skin, right? And this hooding here in the temple is going to stay there once you cut this out, and then you're going to want a brow lift later, and you can't have it because you're not going to be able to close your eyes all the way. So, again, age is just a what's it called, guideline, right? Because everyone's anatomy is different, and your numerical age doesn't naturally match up to your physical age. But usually younger patients are having a winged blepharoplasty like this. This patient up here also had a lateral endoscopic brow lift, mid-face lift, lower blepharoplasty, skin pinch. She had all that with it, which is why the brows arch, which is really what opened this area up more than any sort of winging I would have done is. But the wing helps. We do it every day.